and welcome to another episode of your show, Medical Talk. I'm Dr. Mohammed Al-Mahtab. In the realm of cardiovascular health, coronary artery disease emerges as a silent intruder, stealthily affecting countless lives. Unfortunately, in high-income countries, coronary artery disease is the leading cause of death in both men and women, accounting for about 1/3 of all deaths. This insidious condition takes root as arteries narrow, obstructing the vital blood flow to the heart. In this episode, we will discuss the coronary artery disease symptoms, causes, and preventive measures against coronary artery disease, and we will shed light on the widespread disease but often underestimated health concern. So today we will host Dr. Anas Al-Badawi, a consultant interventional cardiologist, to discuss with him all the details about coronary artery disease, but right after this short break. Welcome back. We're happy to have with us in the studio Dr. Anas Al-Badawi, a consultant interventional cardiologist. Dr. Anas, welcome to Medical Talk.
Thank you very much. Thanks for having me tonight in the Medical Talk, and hopefully it will be a fruitful discussion and a talk.
I'm sure it will be. But at the beginning, let's just give a definition, a basic definition for our viewers about what is basically the coronary artery disease.
When we are speaking about coronary artery disease, we are speaking about the blood supply for the muscle of the heart. As you know, the heart is a muscle pumping since birth to death, and it needs energy and it needs supply. So the blood supply for the heart, it comes through certain vessels. The vessels that supply the muscle of the heart, we call them coronary arteries. These coronary arteries, when they are narrowed or diseased, this is a big issue that we call it coronary artery disease or ischemic heart disease.
Exactly. And basically, what are the common signs and symptoms for coronary artery disease?
Okay, it's a big burden, coronary artery disease, in the whole world. Okay, so this is where the interest come from, because annually there are 18 million deaths all over the world from coronary artery disease. So what are the causes? We are speaking mainly about risk factors, that people who are predisposed to have coronary artery disease. On the top of that, we are speaking about factors that we can change, improve, and factors that we cannot change. The factor that we cannot change, males are more exposed to coronary artery disease. Age, which we cannot change, which is between 50 and above, they are more exposed to coronary artery disease. But the more important for us is the factors that we can change. On the top of that is smoking. Smoking is a major issue as a cause of coronary artery disease. Then comes diseases that we can improve the control of them, like diabetes, hypertension, high blood pressure, obesity. Obesity is a major problem now, especially in the Gulf area here. Lack of exercise. So these are the factors that we can do a lot of things about them, and by working on them, we can improve or prevent coronary artery disease from happening.
So based on that, would you suggest that it's a quite common issue in our region?
It is. I was going through the numbers for Kuwait here. Is number one cause of death. Almost 41% of deaths in Kuwait is due to cardiovascular diseases, heart attacks and stroke. So it's number one killer in the whole world and in Kuwait.
And is there any variation between males and females?
Yes, it's more common in males. It's more common in males, and especially in females before menopause, when they are in the reproductive period, they are more protected. And then when they grow older and they get into the menopause, then they started to get very near to males. But males are more exposed from younger age, from the age of 50 and above. Females may be from the age of 60 and above. They are more exposed.
It's called the bliss of the estrogen, basically.
Yes, absolutely.
Now, I want to go specifically to the signs, signs and symptoms, basically. So what can somebody might experience CAD, basically, could suffer?
Okay, because knowing the heart attack or the symptoms of it is very important for us, because for us time is very important for heart attacks. So if someone came early, he will be treated better and he's going to preserve the muscle of the heart. If he came later or if he comes later, then we will lose the muscle of the heart. So we're speaking about time equals muscle. So to know the symptoms is very important for us. The main symptom is chest pain. Chest pain, when we're speaking about chest pain, there are lots of causes of chest pain. But this one specifically, when we speak about the type of chest pain, is like a central crushing pain. Pain in the center of the heart. Lots of people think the heart is on the right side of the body, so they feel the pain should be on the left side. Should be the pain on the left side. No, it's actually the typical pain we speak about in the center of the of the chest, and then it can radiate, moves to the arm, to the neck, to the jaw, to the back, and usually, if it is a heart attack, the pain might happen even when the patient is sitting at rest.
Without any physical activity. But warning, that people usually describe that they're getting chest pain when they are walking. It stops them from walking. And then when he rests, the pain settles. This is what we call it typical cardiac pain. Other things less common than the chest pain is feeling out of breath, and sometimes feeling dizzy, feeling the heart beating strong. All this can be signs of coronary artery disease. What about, some people may say they feel like a heartburn.
That's right.
Yeah.
Because the pain itself, as I said, is like heaviness, someone putting a rock on the center of your chest. It can vary. It can be like burning, a fire in my chest. So that's the reason sometimes it's confused with the stomach pain, because it's also like a burning pain.
Yeah, because it could mask it,
Yeah.
basically.
Yes.
Now, speaking of the heartburn as well, a lot of people, they have a question about the role of cholesterol in the coronary artery disease. Can you explain to our viewers what's the major factor that we're talking about regarding cholesterol, and how basically to modify our diet to basically avoid the cholesterol effect, high cholesterol to the heart?
Thanks for reminding me, because when I spoke about the risk factors, I forget to mention about the cholesterol. Cholesterol is one of the major risk factors causing coronary artery disease. And in the modern era now, the type of food is very important. Food that contains very high cholesterol, like animal fat, and which is a common tradition or practice in our area here in the Gulf area, that people eat a lot of meat, red meat, that contain high cholesterol content. And there is also a genetic part that can be inherited from the father, from the mother. So when we speak about cholesterol, there's different types of cholesterol. The one that comes from the family, that's we still can do a lot about it, can treat it, and the one we bring it ourselves, that's eating bad food. So our Mediterranean food, the Mediterranean food is usually the best food. A lot of vegetables, a lot of fruits, but when you come to animal products, this is where the problem is.
Exactly. So basically trying to modify your diet to avoid any problems in the future. Now, before we continue, our team, they have prepared a report for us. So we're going to have to watch it, and we'll be right back. Stay with us.
I am Dr. Lazar Lazovic, interventional neuroradiologist that is working in Ibn Sina Hospital now more than 5 years. And I will tell you certain things about the work that we are doing here. So interventional neuroradiology is basically minimally invasive vascular procedure. That means that we are puncturing the certain arteries at the periphery of the human body to enter the vascular system, and then we are driving our instruments that are like tubes, so we call that catheters and certain wires, all over to the neck vessels when we are injecting the dye and seeing the vessels inside of the skull. So basically we are searching for the pathology of the brain blood vessels. Yearly we are doing around 300 procedure. This procedure have a different length, so it goes from 10 minutes up to a couple of hours, depending of is it only a diagnostic procedure or we need to treat certain pathology in the brain. All patients are prepared like for any other surgical intervention, so they need to be admitted the day before the intervention to the hospital. All necessary tests are done, which includes blood tests, ECG, etc. And on the day the procedure, they should be on. They should fast, and then we are doing the procedure. The puncture site is closed by manual compression or with certain devices that we are using for the closure. And usually, if it is elective procedure, patients stay 24-48 hours in the hospital. If they came as acute cases, meaning if the reason is the bleeding in the brain or acute ischemic stroke, then they will stay for a longer period in our neurocritical care or high dependency unit in Ibn Sina hospital. These procedures have certain risks, so these risks going for 3 to 5% if we are speaking about treatments of brain aneurysms and AVMs and dural AV fistulas. And in ischemic strokes, the rate of complication is a little bit higher, but the reason of that is not technique related, but certain complication can be related to the technique, but in general, the complications in stroke patients are happening up to 20 to 30% because these patients are heavily diseased, and it can even with successful intervention, the things can go bad in continuation of the treatment. Regardless of the pros and cons of these procedures, I would like to say that it's always better not to come to the point that you need a medical intervention, even if it is minimally invasive. So control of hypertension, control of body weight, regular exercise, control of diabetes, of blood lipids. It's very important to prevent certain disease of the brain blood vessels and to avoid any kind of procedures that can carry certain risks in final treatment.
Welcome back. We're still talking to Dr. Anas Badawi. Dr. Anas, before the break, we were talking about the coronary artery disease, the definition, the signs and symptoms, and what are the major factors. I want to talk to you about how to diagnose it. Basically, there are so many ways to, professionally diagnose CAD. Could you walk us through that?
Okay. One of the major things for us is the presentation. The history that of the patient is having, as we mentioned earlier, having chest pain when he's doing some effort or something. So we start, when the patient comes into the emergency room with a heart attack, the first thing is that we get him to go quick, as I mentioned earlier, that a minute equal muscle. So quick history by the doctor who is on call, or covering the emergency room, then quick examination, and then we come to the investigations that may be, that's what you mean by more diagnostic things. Simple investigation that we do is we do ECG, which is tracing of the heart, okay, and that will show us a lot, okay, and then we send blood samples. Maybe a lot of our people here, they know about, they said cardiac enzymes. There are certain enzymes, certain blood tests we do when there is a damage to the muscle, that these enzymes go up. And they can go up very early, like after 1 hour from the chest pain. So they are very sensitive to detect blockages in the heart. And then we go more advanced, we do echocardiogram, which is ultrasound of the heart, to see if any part of the heart is not having enough blood, then the muscle movement will be less in that part. So that will tell us also there is a blockage. And then we come more advanced, which is doing an angiogram. An angiogram is a very specialized test that we go in the arteries with a small tube, we call it catheter. So we go from the hand here, or from the leg, and then that's with a small puncture, and then we inject the dye. The dye will go into the coronary arteries, and then an X-ray machine is moving around taking pictures. So it's like a colored image that will tell us exactly where is the blockage, how much is the blockage, how to deal with it. So this is the process that we go through usually to diagnose it.
I want to ask you about the catheter.
Yes.
Because you mentioned it. How the heart catheter is basically, is it high risk? Because a lot of people, they might feel worried about it.
Getting frightened from it, yeah.
The idea of having a catheter inserted to your heart, essentially. Can you explain to our viewers the process in a very simple term?
Okay. We are faced with that when we are suggesting to the patient that we need to go a coronary angiogram, then people get terrified. It's actually very common procedure these days, all over the world. Is not an operation. We call it procedure, because what we do it usually we have a local anesthetic here, and sometimes we give something to relax the patient. It's not anesthesia, general anesthesia, no, it's just local. And then we put a big needle here, we call it sheath, and then through that needle, we do all our job. It's actually, we go with a small tube that very easily comes near to the coronary arteries, and then we inject the dye, and the camera moves. The risk is very small. That's what we do just to see if there is a blockage. The risk might be 1 in 1,000. So it's very negligible in comparison with the advantage of the procedure. And then if there is a blockage, then we will decide usually what is the best treatment for that blockage. We have like 3 options. One of them is to give them medicines. The second option is to use the same catheter and we implant what we call it a stent. There is a balloon inside a metallic mesh, and then we go into the blockage, we inflate the balloon, so the metallic mesh, what we call it a stent, opens and attach itself to the wall of the vessel and keep it patent. This is, we call it angioplasty. Very successful procedure. Success rate is more than 97%.
Wow.
Okay? And the third option is if the narrowings are too many or in too many vessels, sometimes we need to go for a surgery. That's a major one. It's a bypass surgery, opening the chest and trying to bypass the areas where there is a blockage. But still the success rate is very high, more than 95%. So these are the options usually for.
So if I understand it right, it could be a diagnostic and treatment.
Absolutely.
Both combined at the same time.
Yes.
We're going to talk more about the coronary artery disease and the catheters, but I think we need to take a short break, and I'll be right back.
Thank you.
Welcome back. Dr. Anas, before the break, we were talking about catheters. I think one of the main points that a lot of people misunderstand is how long is the procedure itself, and what is the recovery period, and how long would they stay in the hospital? I mean, essentially, during the day and the post-op, basically.
I have noticed here that in Kuwait, people get worried about the contrast that we use.
You mean the material itself?
The material, yeah. The material that we inject into the coronaries to see them by the X-ray. Actually, it's a very safe material that's used all over X-ray or even radiology to see different areas, the brain, the chest, the heart, and these things. And the worry usually about it is like it's affecting the kidneys. Is a very rare complication or a very uncommon complication that can happen. So the procedure itself, diagnostic angiogram, just to see, it will take like 15 minutes or less than that even. So it's a very quick procedure actually. If there is a blockage and we need to open it, then it varies, because it can be a simple blockage that will take like 5 minutes, or it can be a very complex one that it can take 1 or 2 hours. Getting out of the table of the cath lab or the catheterization laboratory that we call it cath lab, then usually if we just did a diagnostic when we saw only the blockages and we didn't put a stent or anything, they usually go home after 4 hours. And then they can, second day they can go back to work, they can drive, no problems. If there is a blockage and then we opened it and we put a stent, then usually we keep them for till the next day.
24 hours.
Yes. Because this is the time, it's like a wound. You give it a bit of a time to heal, and then you observe the patient, put him in a monitor overnight just to see if there is any abnormal heartbeats or anything that can happen sometimes with the procedure. Second day they go home, and now we do it as I told you from the arm here, so it's very easy to walk without any problem. In the old days we used it to do it from the thigh, and that was a bit difficult because when you move there will be a risk of bleeding, but the risk of bleeding is very low with this one. And then usually we'll ask them to take few days rest if we are doing stent, and then within 3-4 days they will start exercise. And actually we are supposedly in 2 weeks time they should be able to exercise half an hour at least. Okay, and usually after that we see them in the clinic. For example, I usually see them after 2 weeks when they started exercise and they reach this have 30 minutes that we are targeting, just to make sure they're doing fine, they're taking their medications regularly. And then, so it's not a major operation to allow time to recover. Usually it's very quick, people can go back to normal life.
So just to make things clear to our viewers, this is a procedure, it's not an operation.
Absolutely.
And it's done with local anesthesia, and the patient is actually conscious during the whole thing. Actually, he or she can actually see.
That's right.
You know, the monitor, and you know, can interact with the physician or the cardiologist who's doing the procedure, and while they're doing it.
Absolutely.
I guess the next question is, for some of our viewers might ask, is it painful? Because, you know, having, like a catheter going inside the heart, would they be able to feel pinch like, or they feel like any pain, or they can experience any discomfort?
Usually the pain is coming from the needle stick, which is like a normal stick, the needle stick in the arm here. But actually we give a local anesthetic. Even
in the heart?
Inside the vessels there is no nerves. Okay, so you won't feel the catheter going into the vessels. Sometimes when we dilate, we put a balloon, we block the blood supply for a few seconds. And that's the time the patient might feel a bit of pain, very similar to the pain that brought him to us, because it's just because of lack of blood supply. But usually it's a painless procedure or very minimal pain. So that's the reason we don't use general anesthesia. Sometimes for people who are very anxious, we give them something to keep them calm, that's all.
What about pregnant women? Is there a guideline for that?
Yes. Now, it's fortunately enough, we don't have a lot of coronary artery disease in young women.
Yes.
And that's a blessing, as you said. You mentioned blessing of estrogen. So, because radiation will affect the babies. But if we have to,
as an emergency.
Yeah, if we have to, the life of the mother is very important for us.
Of course.
More important than the life of the baby. But we take precautions. We cover the abdomen with a lead apron, with a special jacket to prevent radiation to the babies.
Exactly. Now, in terms of lifestyle changes, you mentioned way earlier that the factors that we can control, we can change. What is the main lifestyle change that you can emphasize again and again and again to avoid coronary artery disease?
Just preparing for this program, I was going through the World Health Organization records from Kuwait here. It's actually the number, the main thing, smoking was frightening. That's more than 30% of the population, they do smoke. And the more frightening thing, that's even children at the age of 13 to 15, they do smoke a lot. So if I have one message to say, we have to stop smoking. Stop smoking, stop smoking. This is the main issue that we can do a lot with it. The second issue that will come is the prevalence of obesity. Is almost 50% of the population is suffering from overweight or obesity. So that's a very preventable cause. That's with food, healthy food, and exercise. So we recommend at least people should exercise for 150 minutes per week. That means half an hour 5 days a week, and you have 2 days break. So it's not too much. It's not too much. Okay. So exercise, good food, healthy food. We should avoid junk food. Stop smoking and control diseases. Blood pressure, we need it to be controlled. So our target, the systolic blood pressure, or the one high, should be between 120 and 130, and the one down should be less than 80, 70 to 80. So very tight control of the blood pressure will help a lot.
Exactly.
Tight control of the diabetes. Diabetes, unfortunately, a lot of times you don't feel while it's like eating your heart, eating your body, eating your kidney.
Yeah, your blood vessels, basically.
Because it affects the blood vessels, the big ones and the small ones.
Yeah.
And by the time there is not enough blood going to the brain, going to the heart, going to the kidneys, so diabetes hits everything if it's not well controlled.
Exactly, damaging to the vascular system, basically.
Absolutely,
Yeah.
absolutely. Yeah. And then the last one, if someone have high cholesterol, we have to target the high cholesterol and treat it. There is a lot of talks about that animal fat is not harmful and these things, but the whole scientific evidence that it is harmful, cholesterol is harmful. And when we target cholesterol, we bring it down, we protect the heart.
Dr. Anas, thank you so much for sharing all this valuable information with us. I'm sure we have a lot of points to discuss, but we don't have time. Unfortunately, that's all the time we have. Hopefully, we'll be able to host you again, Medical Talk. Thank you so much.
Thank you very much.
Thank you.
Thank you.
And now, dear viewers, we will have a short break and we'll be right back. Stay with us. Well, that brings us to the end of our show today. Hope you enjoyed it. Until we see you again, please stay safe and stay healthy.